building?
Yes, I am. I'm right here. Can you hear me?
Well, we can hear you. We can hear you. Thank you so much for
Okay.
joining.
Yes, hi, Ellie. Hi, everybody. I'm so excited to be here. Thanks a lot for giving us the time, for giving us the platform. I'm thrilled to be here. What am I supposed to say? Thanks a lot for a seat on our table for accommodating Nerima Health and Education Services. I realized that most of the speakers or some of the speakers were talking in an entrepreneur format or form. So I've got to switch my mentality from the entrepreneur to the nonprofit organization mind frame. Because I was listening to Lorenzo as well, and he was talking about the 5 aspects of where we should spend our money. And I'm like, I beg to differ a little. Like Simone said, when you're spiritual, sometimes you feel like you're blessed to bless others. Before I drift over, yet I don't have too much time. Thanks a lot, Ellie, for having me. I'm quite passionate about Nerima Health and Education Services. So I've got first put that out there. The foundation of my passion is attributed to 2 main aspects. The first one is I was born in Uganda, and when I was just getting into grade 1, my dad passed away. And my family moved from overprivileged to underprivileged overnight. So that was a tough change. However, so moving from a place where we had no electricity, we had no water, we had no communication services, and I had to walk 6 miles to school and back from school. Moving from that point to this point is a story. I know everybody has a story to tell, but is one of the foundations of my passion. And so when I look at the kids who in a similar situation, what I see is a village that is between them and success. I'm not trying to say that I'm successful a lot, but when at this point in my life, anything I get, I feel is for blessing some of those kids so that they can also get elevated. So that's one aspect of my passion, or the foundation of my passion. The second aspect is my mother. She was born in an era when women were not supposed to have education. And luckily enough, she had a bigger brother who felt she had skills and he didn't want them wasted. So what he did is he took her under his wings and educated her. And when she got to grade 6, that was as far as was going. She started knitting aprons and putting herself through school. And eventually she became a teacher. She became a wife, and she became a mother to 6 of us. So moving us from that point, and the 6 of us are now in North America, is a success story that we feel like we need to put back to the community because we were raised by a village. Despite the fact that it was her who was steering the train, it's the village that raised us. So unfortunately, in June last year, my mom succumbed to cancer, but she was passionate about education, and everybody around her, all the kids she got into contact with, she tried to ensure that there was education. And so, sorry, I get so excited sometimes and I lose my train of thought. So she was a very grounded lady. 6 of us are out here. And after the demise of my mom, we sat together with several friends of mine, and we felt that it wasn't good enough letting her efforts go to waste. So we sat and had a discussion about it, and we decided to come up with an organization in memory of her because of her legacy. She achieved so much with so little, and it would be a shame for us to have so much in this technological era and do nothing about it. So we sat together, agreed on starting something, and on October 1st last year, we decided to register an organization in her memory for her legacy. I have a screen to share about what we are looking at. Okay. I'm not sure if okay. Is that working? Okay.
Yep, we can see you.
Sorry, I beg your pardon, Ellie.
Yep, we can see.
Okay.
We see it clearly, Racheal.
Okay, so what we are focusing on right now in Uganda, 20 years ago, I relocated to Canada, hence the registration in Canada and operation in Uganda. So this first screen shows, beg your pardon. This first screen shows what we are focusing on, or the clientele we are looking at. We are looking at the vulnerable youth parents, seniors, disabled, homeless, some people who are in a poor mental health community, and we are trying to offer evidence-based, culturally appropriate, accessible education. And when you look at all this and what we are offering, you don't have to really separate these our clientele for them to attain the necessary information required. So those are the clienteles, or that's our clientele we are looking at. The barriers that we feel our clientele face to have a quality education or quality of life is culture and gender. A lot of it is when you look at early marriages for the young girls, when you look at dowry, girls and education values, some of those are challenges. However, as we look at all that, we also have to look at equality or gender equity, because it seems like of late, most people are moving towards the girl child and the men are being left behind, and we really need those men in the kids' lives as well. So culture and gender affects them. We are looking at beliefs and faith as a barrier. We are looking at disability. We are looking at poverty. When you look at beliefs and faith, there's a lot of witchcraft, not just from Uganda, but several countries in Africa, I believe all around the world. Beliefs like witchcraft deter people from moving ahead, or barriers in the quality of their lifestyle. Then there's also a belief about not disclosing pregnancy at early stages. And because of that, especially the young girls do not seek for antenatal early enough, or guidance or health measures, because they've been told when you're pregnant, you're not supposed to disclose. So we have those beliefs, we have the culture, we have the disability, where there's a belief that families do not want to expose the disabilities in their families, because that is going to hinder other families getting married or having any relationship with them. So it's kind of a stigma. As soon as you have a child who is disabled, the culture has it that you hide them because you don't want that to be exposed. It's going to be tainted against the family. So there are also barriers when it comes to disability, like with that type of society, how is a blind girl going to move? The physical abilities, physical disabilities, a lot of places don't have facilities to help to accommodate the disabilities. And then of course there is the poverty part of it. And we are hoping that if we tackle different areas, then with time, the poverty will also be alleviated. Okay, just give me a second here. I need to move this here a little. Okay, so what we are doing is, when it comes to culture, we are talking to cultural leaders. We are partnering with cultural leaders to see how best we can help our society, or the village as it were. Beliefs, we are also engaging spiritual, we are engaging cultural leaders, we are engaging any kind of leadership and participation in the community to make sure that we remove away the barriers as much as possible. When it comes to disability, we are really focused on accessibility of disability. We are fortunate enough, because we are now operating in Uganda, there's an organization that has given us office space for the next 6 months with disability accessibility, that there are ramps. So as we try to provide preventative measures or education in different locations, we are trying to make sure that the disabled are also able to access and move around comfortably. And then, like we mentioned about poverty alleviation, with time, we are putting together a team that can tackle all this. We don't want to jump in once. There are things that we are doing that we are sure of because they played a big role in us getting to where we are. But we need a team of advisors, and we'll see that as we go along. So what drives our passion? Somebody said something, was it Elaine Robinson? And I like that because one of the things that I like the most is when Nelson Mandela said it takes a village to raise a child. But one thing that Elaine mentioned was it has to be a healthy village. And Elaine, I know you mentioned you are leaving the platform, but I've got to borrow that from you. So we'll be moving it from Nelson Mandela to Elaine. We need a healthy village for that. So I have a few things that drive my passion here. There is that. There is nothing is as strong as an idea whose time has come. That was by Victor Hugo. We used to help the community in small bits and pieces, but we got to a point when my mom passed away. We realized that we can do something bigger than just doing it and get several people on board if there are people who are willing to make better mileage. Like I mentioned, I'm also spiritual, so we believe in be known by works, and that's in James 2:14. And like Nike says, just do it. And then we have, yes, William Hazlitt with where there's a will, there's a way. And yeah, so that's what we are looking at, and that's what drives our passion. So this is the board of directors. If I'm moving so fast, please, Ellie, let me know. I'm trying to beat time before I get a message telling me to slow down or to stop. And this is our organizational structure. We have board members in Canada. Oh, I've got to move this to the side a little, sorry. We have board members in Canada. We are 3 board members. We have a program director. Currently, he's just acting in Uganda. He's called Dr. Soita. So we are trying to work with professionals so that we get it right. Because if you want something done right, you need to have a professional on board. So under him, he has some staff members and volunteers, and we are still looking for more volunteers. And for education, we have Mr. Joshua Namawa, who is also working as a program director. And here we have Racheal Wasicha, right? That's me. Yes, and that's our organizational structure. Moving ahead, the education we are trying to provide is mainly functional education. So we are not looking at the curriculum of kids in school. We are looking at functional education or relevant education to life, to living to improving a quality of life. So we are looking at respect and integrity, leadership. We are looking at food safety, growth, storage, and preparation of food. We are looking at healthy food options. We are looking at hygiene, and that's what that is. So we are also looking at electronic or digital literacy. We've got to admit that the era of hard copy books and mailing out books is of yesterday. And so we are looking at the collapsing of the stacks of books. And why are we looking at electronic books? Because at a button, as soon as you click a button, somebody can have that book available to them. So we are looking at that, and the shipment, the buying and the shipment is at a snap of a finger. We also look at, like I mentioned, I was born in Africa or Uganda. I grew up, I attained all my education. I came here as a graduate. But I remember when we were in school, they always asked us, white as, and we always had to put snow, yet we had never seen snow. So some of these visual aspects of digital media is going to help the community or the village see what they're talking about. And then the phonics. I grew up to now, I can't say that my phonics are perfect because I still have a bit of accent, Ugandan accent, and merging it with Canadian. But our phonics were really a little off because we were given the spellings, but we had to figure out what the pronunciations were. So also when you look at the storage space, wear and tear, and share or group location, you can have a lot of several people listening to a digital media, whether it's visual or not, you have a bigger group of people doing that. And then the updates and content is really can evolve quite fast. So what is Nerima Health and Education Services about? It's all about promotion. We do not want to deal with the disease control. We need to promote health by preventative measures. This part here, unfortunately, we are short of time, and we have the director responsible for health in Uganda, Dr. Soita. He's the best person to touch this, but it looks at the diseases in Uganda and what preventative measures we can use for intervening. So coming to this, the prevention that we are looking at is there are two, I'm not sure if everybody has heard about the upstream and downstream concept. So basically, when it comes downstream, it's all about treatment of people who are drowning, while upstream is about putting barriers so that people do not fall down a cliff or drown or come down. So we are focusing on the upstream concept that puts barriers that will educate the communities so they have the necessary tools to avoid or to prevent the diseases that I mentioned above. I'm not very good at health because I have no medical expertise. I have no medical literature apart from the little that I read around. So this is a hummingbird inspiration. I don't know how much time I have, but in summary, when you look at a hummingbird inspiration, it's about a hummingbird and several birds and animals that lived in a forest, and there was a fire. All this information will be on our website. So if anyone is interested in reading the detail, please find it on our website. So these animals were in a forest. It caught fire, and they ran for their life, and they all ended up at a source of water. And then the hummingbird started ferrying water using its beak. And after a few laps, one of the animals asked him, what do you think you're doing? And he's like, I'm doing the best I can with what I have. So I'm hoping, and I'm so grateful, Ellie, for giving us this platform, because I believe we are going to move from the hummingbird concept to several people coming on board to help in any way, shape, or form. And this is what we've done thus far. Like I mentioned earlier, we registered October 1st, 2020. So between October 1st and December 2020, we've received donations of BP machines, glucometers, they're all there, Hoyer lifters, sanitizers, surgical masks. We've also been able to donate BP machines, the oximeters, cash. We've been able to donate that. We've held health forums, women's health forums for preventative measures. We've also had a children's Christmas party. So what we try to do is create a situation where all our vulnerable clientele are, and then we try to educate them on preventative measures. So we've held only two. We believe, not we believe, but the fact is COVID has kind of slowed us down, but we are still planning on several interventions soon. Actually, we are hoping to have a camping session in June, May or June, and also in October, mainly the youth. So beg your pardon. We've had also we held meetings between those two periods, October and December, with hospice, Joy Hospice in Uganda, Mother's Heart, health and education commissioners in Uganda. We held meetings with the Archbishop. We held stakeholders meetings. We held meetings with the Sitema University, Institute of Public Health, and Bureau of Statistics, because we need all these as partners aboard on what we are trying to accomplish, and they are great partners. So here we are. That's me. We had a meeting with hospice, and those are the medical personnel at hospice. These are a few photos. Those are some of the things we dropped off. to hospice. Oh, that's one of our biggest volunteer. She was putting together packages to be sent to loot bags for children. That was in Canada. She was putting together loot bags for the children's Christmas party, and we had about over 160 children. Oh, there they are at the Christmas party. I believe you can see some of those. All this information is going to be on our website. The previous one is the health forums with women's health forums that were held. And we are also, like I mentioned earlier on, many men are missing in action because society seems to be focusing more on the girl child, but we also need men aboard and training them that this is going to be to their advantage. If the ladies are trained and they have the necessary education, there will be improved hygiene in the families, and it will be to their benefit. So because what we've realized is many of them are looking at it like the West is trying to compromise their families by taking away the girls and educating them, and they're getting no attention. So we are hoping to integrate them all for a better community. So how are we planning on intervene? How our interventions are working? We are offering, like we saw in the last pictures, there were some free blood pressure readings, weight, temperature checks, and like I mentioned earlier, we are planning on youth camps in Uganda, and they are going to focus on leadership, education, and health. And then we are also looking for volunteers. The head of, like I mentioned earlier on, Dr. Soita is heading the research in Uganda. So he will be looking at blood pressure and related issues because he's looking at the health issues. And then we have the health, including mental health, and he's spearheading that. And then we're also looking at donations, purchasing, receiving, and shipping of donations. We did not give away everything. We still have some donations that we received in storage because we hadn't yet gotten who to give it to. And so whoever is listening, whoever is watching, and anyone out there, this is what we are looking for. Please be part of it. We are looking for volunteers for board of directors, advisory members both in Uganda and Canada, content sourcing and development for health and education, IT support, donations, like I mentioned earlier.
Wow.
And then we have, those are with thanks to our stakeholders, like I mentioned earlier on, Busitema University Institute of Public Health, Mount Elgon Hospital in Mbale, Uganda, the Church of Uganda, headed by the Archbishop, who is on board and is willing to support us in whatever we need to make to meet our goals and objectives. Intercenter Uganda Limited, which has given us a space for the next 6 months for as offices. Then we work with Nur Islamic Institute, which is in Mbale. We work on, thanks to also Bishop Wasiche Suya Women's Group in Mbale that we've been holding with sessions, Joy Hospice in Mbale, Mother's Heart, and yes, those are our stakeholders. And these are our contacts. We have a website going, Nerima Health and Education Services @gmail.com is our email. But if anyone wants to contact us, we have a website that is still in the works. But if you go to nerimaservices.org, it should lead you to our website. And please drop us a line, give us any kind of advice. Let's keep the discussion going. Sometimes we get comfortable and that's where I'm a little different from Lorenzo, because we sometimes focus a lot on ourselves, and yet it's the village that got us to where we are. We also need to help some of the kids also come up just the way they helped us come up. Okay, that's about it. Thank you very much. Any questions? I hope I haven't run way past my time.
No, you're good. Thank you so much, Racheal, for sharing all of this information with us. We appreciate you. Anybody that wants to get in touch, here is the contact information. You want to email Nerima Health and Education Services @gmail.com. And then you guys are also on Instagram as well @Nerima Health. So thank you so much, Racheal, and we'll definitely be in touch.
Thanks a lot, Ellie, for having us. And bye, everybody. Stay safe out there. And we're also on WhatsApp. There's a WhatsApp number down there. This slide will be on the website. So if anyone is interested in any information, it's all on the website. Thanks a lot, Ellie. Bye, everybody.
You're
Keep
welcome.
safe out there.
Take care. Bye. Okay, guys, thank you all for joining. Of course, you know what's going on right now. We're excited because we have a live performance from Sose Picasso at this point, and I'm excited to hear all about it. So Nerima,